आमच्या वांगडा हा डॉक्टर जगदीश अँड डॉक्टर जगदीश थँक्यू सो मच मातशें टायम काडलो म्हणजे तुमी ही आता दुसरी बस हा दिस इज अनदर बस वी कॅन गो दॅट साइड कॅन यू टेल अस अबाउट दिस कॅन्सर डिटेक्शन bus unit can you tell us about this we can go inside and directly talk yeah
So
yes sir
we are inside the cancer screening and detection Abhiyan bus. This bus has been donated to us for the Goa Medical College by Honorable Shripad Bhai. When he was Minister of Ayush, he arranged this through a 3 crore allotment of corporate social responsibility CSR from Bharat Electronic Limited, the ones who make the voting machines for
Yes.
elections. And this bus was manufactured as per the requirements of the Goa Medical College department specialists by an agency called CDAC from Trivandrum. Now, since the time that this van has been launched in Goa, and to my knowledge it's the only second of its kind of a van, the other one being at King George Medical College, Lucknow. Inside one van we can detect up to 8 cancers, because in this, as you can see here, we have 2 machines here for the blood tests.
okay
We have the machines for the hematology, the blood test. We have the machines for biochemistry.
okay
And for tumor markers, that is early markers of cancer, samples are collected and taken to the Goa Medical College.
yeah
And the reports are conveyed. These are our doctors here with us,
yeah
resident doctors and students who are involved actively in the conduct of camp.
yes
And they send the reports to the patients through the health centers. Like here we have 2 health centers, that is PHC Chimbel and UHTC at Santa Cruz.
yeah
Now you come inside here, you'll see the other part of the lab.
I might not get network there but I'll stand here yeah
So here we have the mammography machine.
yes
So we can do digital mammography here for women who are more than 40 years of age. We also have ultrasound, so that the ultrasound can be done for phonomammography
Yeah.
for early detection of breast cancer below the age of 40 years. That is as per the advice of the standard guidelines. And we also have an X-ray unit here where a digital X-ray can be taken of the head, face, neck to see any spread of oral cancer, or chest X-ray can be taken to see if there is any detection of a cancer in the lungs. If you see ahead, patients who are suspected to have gynecological cancer,
yeah
here we have a specialist from the Department of Radiology, Obstetric Gynecology. They are here to see that the women who are being screened by questionnaire and examined by the gynecologist separately only in the presence of women, they are brought here, and if pap smear needs to be done, the sample is collected, taken to the Department of Pathology, Goa Medical College, and again the reports are conveyed to the health center. All these services, the cancer screening services, are free of cost. The tests are free of cost. And Goa government, particularly Honorable Health Minister Shri Vishwajit Rani, has taken the initiative, and this camp particularly has been the initiative of Ms. Gazela Araujo and her father, who was the Sarpanch of Santa Cruz, Mr. Marian Araujo, is very much active and arranged this camp today. So the people of Santa Cruz are benefiting from this 21st camp.
right
So far in 20 camps we have screened about 4,500 people.
okay
We have detected about 18 confirmed cancers. All are treated free of cost at District Hospital of the Medical College, operated, given chemotherapy or radiation, and all are alive. So we want people to remember this, that if you detect it early, you save your life. You save your family from out-of-pocket expenses. You save your family from going into financial crisis, emotional and mental health crisis. Because a diagnosis of cancer is shattering for the entire family. Not only this, as you must have seen in the dental van or any other pre-cancerous regions like maybe wards, all those are treated by them on those dental chairs in the van itself.
yeah
And that which cannot be treated in the van is referred to the Goa Dental College. 84 patients have been diagnosed so far with precancerous condition. That is one step before cancer. So effectively, all those 84 precancerous lesions are saved from getting cancers, and those 18 people who were detected with cancers in early stage are all alive. So thanks to all these doctors from all these specialties of Goa Medical College, the Goa Dental College, we are happy to introduce this system in Goa of removing fear from people's mind of being diagnosed with cancer.
Doctor, I just have one layman question here. So, if a person is on stage 1, stage 2 cancer, uh, is these treatments done in Goa, and where do people come to, first of all, screening,
Yes.
and secondly is treatment?
Well, the pure meaning of screening is checking normal individuals for cancer.
Yeah.
That's a bit difficult to do because you have to screen thousands of people to find one case.
Yeah.
So in our campaign, we have adopted something called as a two-stage screening. In the community, we create awareness of the warning symptoms and signs, and then call the people with warning symptoms and signs. So in its pure sense, what we are doing is early detection and not screening. Your screening is healthy people's check. We have not yet reached that stage where people can be made aware to check themselves even without symptom signs.
Right.
That is the most ideal thing to do. But at least we request people who have warning symptoms and signs. I will show you on the outside of the van. You can also make people aware because you put it in English and local language. What are the warning symptoms and signs? If you have them, don't delay.
And where if they have these symptoms, where do they come?
They can come to any health center of Goa.
Okay.
They can come to the district hospital. They can come to the medical college. Depending on the organ affected, they can go to surgery, obstetric gynec, they can go to dental, they can go to the respiratory medicine.
Or come to oncology department?
Oncology would come to a stage where the diagnosis is already done,
Okay.
and a decision on chemotherapy or plan of action,
True.
plan of treatment is being done.
Amazing.
All facilities are being offered in Goa right now,
Okay.
and the most important thing, unlike most parts of India, it's offered by the government of Goa free of cost. It's a huge service done by the government, particularly the health department.
And it's on people to take advantage and come
People
in.
must take advantage, and as we saw today morning,
Yeah.
sometimes even the priests and the seniors are reluctant to have a diagnosis of
Yeah.
cancer.
Yeah.
Maybe you could also have a look at around the
Yes.
van and show the symptoms and
Yes,
signs
sure.
which you have to
We'll
put
do
up
that. We'll do
and
that.
make people aware of it. These are the facilities which are being offered.
Yeah.
Mammography, digital X-ray, ultrasound, ECG in case of an emergency,
Yeah.
hematology, and blood test and biochemistry test. We have a colposcope here and a cryosurgery unit.
Right.
So early stages of uterus cervical lesions
Yeah.
can be treated. I'll show you
Right.
the warning symptoms and signs. This is the agency which has kindly
CSR.
donated the 3 crore.
Yeah.
This is the key message we want to give to the people.
Right.
Early detection saves life.
Right.
कॅन्सर का शीघ्र पता लगाने से जीवन बच जातं. तो लोकांनी भियेन असताना पुढे सरपाक
होय.
जाय. मुखार येवपाक
असं झालं असतलेच. You cannot hide. You cannot fear म्हणतात.
डिले करता तिथे तुमका त्रास तुमका
Normally the people think that I'm living a good life. Why do I want to take stress of cancer? But if it is to come, it will come. So it's better you meet that road
we are all
before.
mortals.
Right.
At some stage of life we all get some
होय.
things or the other.
होय.
पण जर बेगीन कळलें
होय.
उपाय जाता, तुमचे लाईफ सेव्ह जाता, तुमचे पयशे सेव्ह जाता. तुम्ही लेट स्टेजीन जर आयले जाल्यार नो डावट डॉक्टर्स विल ट्रीट, पण सर्वायवल चान्सीस देंवता
होय.
आनी पयशांचो कितलो वेस्टेज जाता. हे पळयात ते रोगाचे लक्षणां आसात.
Okay.
की कोणाकूय जर हे सिम्पटम्स आनी सायन्स आसा आनी
Just
लक्ष
English and
दिवचें.
Master, if you can say.
If a person is suffering from chronic indigestion,
Yeah.
he doesn't digest his food properly. If he has lost appetite, जेवण नाका दिसता. If he has lost weight, supposing ताका छातीचेर any tumor or any swelling
Yeah.
on the breast a lady has,
Yes.
or there's a discharge from the nipple, or the nipple which was outward has become flattened or pulled inside.
Okay.
If there are changes in the skin or dimpling of the skin or any puckering of skin or any skin changes are there, if the size and shape of the breast has changed, normally one breast is lower than the other. If you notice both have become at the same level, that means there is some growth inside. Or if you see in the armpits or in the neck any lymph node, good lagta, जाल्यार डॉक्टरा फुडें येवचें, neglect करपाचें ना. Because we have seen breast cancers becoming number one cause of cancers in women, unlike in the past where cervical cancer was common. Cervical cancer has fortunately gone down, but breast cancer has increased, primarily because of lifestyle changes and because some women are not breastfeeding. First 6 months, only mother's milk should be given. Nothing else should be given.
Doctor, the 5 things that you can say, these are the symptoms generally we find in Goa for cancer patient. What will be those 5 top things?
The breast cancer is the most common one. So the symptoms are already told.
Detect the lumps
lump in the breast, any swelling in the breast,
right?
Nipple changes, any discharge from nipple, blood coming from
right,
nipple,
that you mentioned.
Skin changes on the breast or any lymph node around.
Lymph node.
That is a sign. Bleeding from the from the vagina.
Yeah.
The women, supposing she is having abnormal bleeding,
Yeah.
intermenstrual bleeding,
Yeah.
or any discharge which is unexpected, she should go to the
Come to the
gynecologist
doctor, yeah.
and check. One important thing I want to tell.
Yeah.
Women often think that everything about women's health should go to the gynecologist.
Yeah.
No doubt. But breast is dealt by the surgeon. So breastaचे कितें problem असले, जाल्यार it is better to go to the surgeon.
Right.
Okay? Because surgeon knows about the breast conditions. He can check or she can check the breast properly and detect early, refer for a biopsy and get it detected in time. For gynec cancers, of course, you should go to the gynecologist. The third common cancer among women is ovarian cancer. We don't have set screening guidelines for ovarian cancer, but ultrasounds can detect it. Particularly if you have a family history, maybe the women should check them regularly. So that also can be checked by the gynecologist.
Okay.
But if a person has unexplained loss of weight, unexplained loss of appetite, if a person has fever for a long time and cause is not known, if a person feels at any part of his body there is a swelling which is not explained, even if it is painless, because cancer doesn't cause pain in the early stages. Pain in cancer is usually a late stage. Don't wait for that. Supposing you are passing blood in the motion, blood in the urine, any change in bowel bladder habits, or any change in your abdomen, you find any pain in the abdomen, you must go for a checkup early. Now we have some moles and marks on the skin. If you find that mole is increasing in size, you must get it checked. Supposing you have a wart on the neck or the body, and the wart is growing larger, go for a checkup. These are the general things. If you have any ulcer on the body, whether it's on the mouth or any part, it's not healing, go for a checkup. That's how we can detect cancer early.
Amazing. Doctor, thank you so much. So patiently you have given time, because these are some things which generally people would have questions, and you have clarified those things. I hope this initiative by the government helps many, and we are able to detect those few cases that will that you guys can help and cure. Thank you so much for your time. And this today now, since the opening segment took time, will this session go on till 2 o'clock?
Yes. I hope the people of Santa Cruz, आमचे सांता क्रूजचे मोगाळ भाव भयणां जे 40 वर्सांच्या वयर आहा तांणी येवन ह्या कॅम्पाचो फायदो घेवचो. Please come and take the facilities of this camp which have come to your doorstep. We usually don't come to the same place again, because there is a persistent demand to go elsewhere. Okay?
I'm surely going to do. I'm 40 plus, so I will also be screening today. Thank you so much, Doctor.
Thank you.
God bless you.